to us 2 years ago from the University of Kentucky from a legendary health communication research team, and he's continuing his legacy here. Grad students and faculty. Legendary legacy.
Wow, those are big words.
He has published more than 80 articles and chapters, various chapters, all throughout the social sciences on his work, which has to do with media campaigns, message testing, theories of health behavior change, but also methodological issues, meta-analyses, and other evaluation issues. So he also has a recent book, E-Health Applications. Check it out at the library. And he is PI, co-PI on numerous externally funded studies. So we're very lucky to have him. In short, he is a rock star in the health club world. So I hope you've been practicing your air guitar move stuff. And I will turn it over to you. Thank you.
All right. Thanks, Noar. Wowie. All right. Thank you, Noar. Appreciate the wonderful introduction. Now I have to do something that lives up to that in some way. I will do my best. All right. Great to be with you. And as mentioned, my little abstract I sent around, I'm going to be talking about public figure and or celebrity announcements about cancer, implications for health communication. And this is really a brand new area of research for me. As Noar mentioned, I joined the school, of course, actually a little bit over a year ago. Last July is when we arrived here. And I'm sort of doing some more cancer work now that I'm at UNC. And so this is kind of a very new area, so I'm really interested in just sharing some of the stuff we're doing, sharing some of the ideas, getting input from people, and hopefully ultimately starting to collaborate with more folks in this and other areas. So I had to acknowledge Lineberger Cancer Center, who provided funding for some of the stuff that I'll talk about here, and lots of great collaborators on this. Some of them that are with us, Jess Myrick, who you may have heard just had an article accepted for publication that came out of this. That's very, very exciting. She also should get an award for the fastest revision I've ever seen in my life. So she got to revise and resubmit and submitted, I think it was something like 48 hours later. So I don't know that I've ever seen anyone turn around that quickly. So very impressive. Jessica Willoughby is another one of our doctoral students. And Jennifer Brown, who is actually an MPH student in the IHC program, worked on this with us. And some other folks, Kurt Ribisel in School of Public Health, who incidentally, I'm not sure if he even knows, actually is the person who got me interested in this area when he asked me to work on this one study that I'll probably talk about a little bit. And also we had we brought in a couple colleagues from Harvard and Johns Hopkins who do some of this cool stuff with Google Insights that I'll probably talk about a little bit here. And I wanted to acknowledge them on this. We brought them in actually to do a little training to show us some of that stuff, and some folks did that. All right. So we'll see how we do here. If people have questions or as we go, feel free to jump in. I may have prepared more than I'll have time for, and we can skip over things or whatever as necessary. But Jess described this as relatively informal, so feel free to jump in if people have questions or things as we go. Okay, so cancer is bad. We can probably all agree on that. Some statistics here in terms of 1 in 2 people in their lifetime being diagnosed. And in 2012 alone, about 1.5 million people will be diagnosed with some form of cancer. More than 500,000 will die. And the part that interests me and that lots of folks focus on, particularly us more behavioral and communication folks, are, well, a lot of this is attributable to our behavior, right? So smoking cigarettes, eating a poor diet, being sedentary, not going and getting cancer screenings at recommended periods, going indoor tanning, which is a new area I'm starting to work on with some students here, and there's lots of other behaviors. So we certainly can't prevent all cancer, and there certainly are factors outside of our control, genetic factors, But there's a large amount that's within our control. And so, for example, of the 500,000 people who die every year, 1/3 of those are due to tobacco, right? It's kind of remarkable that almost 450,000 people still die every year of tobacco-related disease, even though we now know all about the bad stuff in cigarettes. But that is the case. And of course, obesity is the new big threat. So that's part of the problem. So that's sort of the disease problem. The communication problem is, how do we get more people to do the healthier behaviors and not do the riskier behaviors, the bad behaviors? Cancer is not necessarily the most exciting thing to talk about if you're out at a party and you want to liven up the conversation. The C word is probably not the way to do it. And especially younger people, it's likely not to be top on their list of things to really focus on, think about. So one question we have is, well, how can we engage the public in this issue more, particularly certain at-risk audiences? How can we promote healthy behaviors that reduce risk of cancer? And so you can probably already tell prevention is sort of my passion in many ways. That's sort of what I'm most interested in. And when I did lots of work in HIV, I'll probably continue to do a little work in HIV, was really focused on prevention, similarly in cancer. So how can we get people to do more healthy behaviors that will prevent cancer? So, well, lots of our theories tell us, related to communication, if we want to try to change behavior, we have to expose people to messages that may be effective, right? So we can have the best interventions or messages in the world, but if we can't expose people to them, they're not going to be effective. And there's various examples, like, for example, Noar mentioned the eHealth book that we just published, the edited book that we did. So one area is internet-based interventions, right? There's lots of stuff going on there. People are excited about the internet. But one recurring problem in that area is people are building these great interventions, but getting people to use them is another story. So we can build the right stuff, but how do we get people to do this stuff? And so lots of our theories tell us, in the persuasion continuum, some of the first steps are exposure, attention, and personal relevance. So how can we get people to notice these messages, attend to the kinds of messages that we want to promote, and how can we get folks to think about this in terms of some personal relevance? And then there's also source credibility, which we know is important in terms of who it comes from. And so I can go out there, or an MD can go out there and preach about it, and people may not listen. But sometimes other sources can be more effective, and so there's a lot of this stuff are things that we look at. So one approach that we love in health communication are campaigns, right? This kind of very careful thing where we develop the kinds of messages we think are important. We buy airtime. Communication campaigns are starting to look more like advertising campaigns, right? We used to run really lame PSAs in the middle of the night, and no one watched them, and they had no effects. And now we do all the kinds of things that ad campaigns do. Oftentimes we bring in creative talent. We purchase airtime. So we do all the kinds of formative research and message development, pre-testing. And so these are, I think, are something that we should consider in certain cases. One problem with them is they're very expensive. So the ONDCP is the Office of National Drug Control Policy. They launched, I think it was in 1998, the largest media campaign in U.S. history, $2 billion effort. $1 billion was spent, $1 billion was matched. That's a lot of money. And you can argue about whether that is a worthwhile approach or not. Unfortunately, that campaign in the early stages, the evidence didn't suggest that it did very much in the positive direction. Other campaigns have been more successful, such as the Truth Campaign and Verb Campaign. And I have to mention, especially since Noar is here, that some of the recent ONDCP stuff has been effective. And Noar, working with Mike Slater, have done some really nice stuff in that area and showing that the Above the Influenced brand has done much better. So let's move on from that, because that's not the stuff I'm going to talk about, but I'm going to contrast that with this. That's kind of the typical approach that we take, and in public health too, we develop interventions. And so my interest started to get into this case where we don't do that whole careful, methodical thing, but bam, Steve Jobs dies, right? Or another big public figure or celebrity dies of cancer, or someone gets diagnosed. And wow, all of a sudden, everyone's talking about pancreatic cancer. When none of us were talking about it yesterday, today everyone's talking about pancreatic cancer. And so can we use these kinds of events for some positive influence in terms of cancer? Well, it probably won't take much, especially in this audience, to convince you guys that we have a pretty big media culture, and the U.S., we're a pretty celebrity-obsessed culture. In fact, if anyone knows, let me know. I think there may be an index out there somewhere of different cultures and in terms of celebrity obsession or gossip, and I need to find that because I'm sure that we are very high on that. And so, well, if that's the case and these events happen, maybe we can use them for some good. And so here, in this case, the media is doing all this great stuff for us for free. Right? So they are putting out all of these kinds of messages that may have the exact kinds of effects that we want to have. Or maybe they aren't. Maybe they have some bad effects. But we need to study this and to kind of find out. And it turns out, you can see from this graphic, this happens a lot, right? This happens relatively often. You have Patrick Swayze, Steve Jobs, Michael Douglas, Elizabeth Edwards, Farrah Fawcett, Peter Jennings. And we put together this nice little timeline, which you may or may not be able to see, but essentially, and this was not comprehensive, but we tried to pick some of the higher profile events. And you can see this goes from 2004 to 2012. And so this happens a fair amount. And these events get a lot of media attention. And oftentimes it varies. So when a person's diagnosed, there's a splash in the media, particularly a big figure. When the person dies, that's often another splash. There may be other stories that are going on about treatment and other kinds of things. So there's kind of a lot going on here that we need to understand. So a couple of the key questions in this area, the first question is really the main one that we've started to focus on, which is what's sort of the natural course of these events? So these events just happen, right? Steve Jobs died. It's a huge story. And so were there any effects of that in terms of things specific to behavior or attitudes or information seeking, things like that? So what's going on there? And that's really the main area that we're focusing on. But I believe that has big implications for number two, and this is an area where this is kind of the implication that we're just starting to think about. Can these events be harnessed for cancer communication, prevention? So one question is, what happens just sort of naturalistically, and then that can inform a second question, which is, can cancer advocacy groups, can other folks use these kinds of events, build on these events to do greater things in terms of prevention, education, communication, et cetera? You guys with me so far? Okay. So this is where we start to get into news. And it's very cool because I'm in a School of Journalism and Mass Communication now. And I really have not done a lot of research with news to date, but I'm getting very interested in it. And so when one of these events happens, there's a whole set of news-related questions that come up, right? So Steve Jobs dies, and so what happens? What's the news volume around this issue? How much volume over what period of time? Yes, Rhonda.
Is the event only the death, or what about diagnosis and then announcement?
No, absolutely.
When you say event, though, you're referring to?
Event, I'm referring to a major public figure or celebrity getting diagnosed, or that being made public. Sometimes they get diagnosed, right? And when they actually got diagnosed versus when they went public may be different time. But yes, when.
Rock Hudson coming
Yeah.
out and being HIV positive put that disease on the map.
Absolutely.
So the announcement was almost as
Yeah.
They weren't too far apart.
Absolutely. And Magic Johnson was another huge one, which has, and from what we can tell, Magic Johnson is the most well-studied case in terms of doing research and trying to see what kinds of effects are we having there. So yeah, so by event, I mean a diagnosis being revealed or a death. Those are the two major kind of events that we've been focusing on. And so you have all these questions about news and the coverage. Does it talk about prevention? Does it talk about screening? Does it talk about the kinds of stuff that some of us really want to see more done about? Does it not? There's all kinds of interesting questions, I think, about that, which could involve various methodologies. And then there are all these questions about people, effects on people, right? So is there an effect out there of this kind of thing? Are people seeking information about the celebrity and or the cancer? What kind of information are they seeking? Are they talking to people about it? Are they changing their behavior? Are they going out to get screened themselves? And if so, among whom? And so as we'll see, a lot of studies that have been done have looked at this. They haven't always done as good a job at looking at among whom it's happening. So we got sort of these two different sets of questions. Oh, and of course there is a linkage among these things, and the extent that we can connect what's going on in news with effects on people, that's pretty exciting. So in terms of just research in general, this is kind of a neat area in that there's lots of different methodologies that we can use, right? We can do content analysis, and there have been some content analyses done in this area to look at what kind of coverage takes place when one of these events happens. There's survey research. We've done a couple survey research studies involving Steve Jobs. As we may talk about, to do survey research, you really have to move quickly, because obviously you never know when this is going to happen, and an event happens, and you have to move very quickly in order to pull it off. There's online search query surveillance, which I will talk about a little bit here. And there's medical data on procedures and surgeries and preventive exams and things are unobtrusive data that are out there, so we can do studies looking at those and seeing if there are trends and things that are happening in response to these events. So it's kind of interesting in that it's an area that really lends itself to a lot of different kinds of studies, a lot of different kinds of methodologies. And so far, we have first done a systematic review in this area. I was really surprised that there was no review paper that we could find anywhere in this area systematically reviewing the studies that have been done. We also have done a couple studies of looking at Steve Jobs and pancreatic cancer, and then we did this online search query surveillance study as well, looking at pancreatic cancer. Okay, so my plan, by the way, is to talk a little bit about sort of the systematic review, which is a little bit about what's this literature, what do we know about this area, then hopefully to say a little bit about at least one of our Steve Jobs studies, which goes into the pancreatic cancer Google stuff. So we'll see how we do here. And again, feel free to jump in with questions or things like that. I've tried to make this not an incredibly data-heavy presentation, but a little bit lighter and more about kind of what's going on and ideas and things as I've following what others have done. So systematic review. So the other thing I should say is that we are in the middle of this research right now. Actually, we got to revise and resubmit on this article, so we were happy about that. So we've made a lot of headway on this, but we're still working on some of this. So we have 19 studies that we found in this area. And you can see some of the data up here. It's actually a fairly limited set of public figures and a fairly limited set of cancers that have been studied. Actually, I only listed up here the most commonly studied ones. So there's a few others that aren't up here. But 19 studies, you can see that the most popular ones here are folks that are, it's a relatively small group. And breast cancer turns out to be the big winner with 10 of 19 studies focused on breast cancer, 4 on cervical cancer. The stuff that's shaded in gray, the Steve Jobs and pancreatic, those are largely the studies that we have done, which we're including in the review. But I wanted to shade those out because if you take those out, those are new things that we've done. And there's been a lot, as you can see, done in the UK and Australia in addition to the US. Okay, so what are we talking about? How about some examples and selected findings of what is the literature showing, particularly some of these higher profile ones. We have the first and second ladies, Betty Ford and Happy Rockefeller. So best we can tell, this is one of the first, if not probably the first study on this. And so Betty Ford and Happy Rockefeller were first and second ladies, and they actually had breast cancer surgeries like 2 weeks apart. And that was obviously a significant event. And a couple studies have shown some effects of that, not only on breast cancer media coverage, but also on breast cancer screening. Now, of course, these kinds of studies are obviously not sort of randomized controlled studies, but essentially they're sort of observational studies, and you see this kind of trend of things staying the same, and then you have the event, and wow, you see this big spike, and then oftentimes it goes back to what it was before the event. So we can make the claim that it's highly, highly likely that this was the cause of the change. In fact, this recent paper we just found looked over a 35-year period of breast cancer media coverage and found only 2 events were associated with significant spikes in coverage, and this was one of the 2 events. And then, as I mentioned, you've got the rise in screening. Nancy Reagan, who had a breast cancer surgery in 1987. I don't know what it's. I don't know what's about our first and second ladies. But this also a study here showing large amounts of the U.S. population being exposed to what happened here, to coverage of it. And so what happened here is apparently Nancy Reagan was a good candidate for a more limited surgery, not sort of a more radical mastectomy, and she chose to have the more radical procedure. I believe at the time she said something like, "I'm first lady, and I can't mess around with a surgery that could possibly not get all the cancer," or something like that. So a study actually showed that this apparently had an effect on women's choices about what type of cancer to get. So here it says women were 25% less likely to undergo breast conserving surgery for 6 months after the announcement. So actual effects on surgery choice, which is pretty incredible. So a lot of the studies in the U.S., interestingly, were kind of older. And one conclusion here is that in more contemporary times, there haven't been as many studies of this phenomena. I don't know why. So the newer studies tend to be a couple of folks that I mentioned earlier here. So one of them is Jade Goody. She was a UK reality television star. She was diagnosed with cervical cancer in 2008, sadly died in 2009. And this got a lot of attention. And a couple of findings here in terms of newspaper articles. So there's been some content analysis looking at when these kinds of stories are covered, what are they covering, and incredibly, cervical cancer screenings nearly doubled during the month of her death, from over 15,000 to over 26,000. So that's a huge effect. I don't think I've ever seen any campaign or intervention that we could ever develop that would have an effect of that size. That's pretty incredible. So that's an effect on cancer screening behavior. And Kylie Minogue is another one that got a lot of attention. There were several studies on so she was an Australian-British singer-songwriter. She was diagnosed with breast cancer in 2005. Again, we're show the effect on news here. So in the week following the announcement, there was a 20-fold increase in TV news coverage of breast cancer. And the 2 weeks following the announcement, 40% increase in mammography appointments, as well as a big increase in women who were going to get a mammogram for the first time. So again, effects on news and significant effects on screening. Something that I'll mention later is that most of these kinds of things seem to be positive. There is sort of a potentially negative side that we need to keep an eye out for. So that when I first saw a number of women getting first mammography, oh, that's great. because typically, that can often be a hard group. However, it turns out many of these women were very young and way below the age where it's recommended. And as time goes on, we're learning about more and more of negative effects of screening folks who likely do not need to be screened. So that's something we may get talk about at the end, about that there is potential for some negative effects of these kinds of things. Okay, so across the studies, we do see a lot of effects on a variety of outcomes, studying cancer, effect on cancer news, information seeking, and some other kinds of behaviors, including interpersonal communication. And so there are a lot of important outcomes, I think, to look at here in terms of what's going on. And like I said, there's been kind of a limited number of studies, so we really don't have a sophisticated understanding of a lot of these things. So one thing that we've done in this review paper is we've tried to put together a conceptual model to help kind of frame the way that we're thinking about this area. And so it starts with, well, who is the public figure, right? Which is probably the first most important thing that we need to look at. So who is this person? How well known are they? Because you do have, unfortunately, people getting cancer all the time, and you have people who might be a CEO somewhere or some other sort of more minor figure that may not get very much media attention. So how well known is this person? Do they have celebrity status? Steve Jobs clearly had sort of a celebrity status, whereas I would guess that many other CEOs do not. So that may have an effect. Also, the age of the public figure is likely to have an impact, right? So some of the cases that are out there are people who have gotten cancer at a much younger age than is typical. And so that may draw more media attention, and that also can potentially lead to negative effects of very young people saying, oh, maybe I should go get screened. So there's kind of a little bit of a mix there. So you've got all these different pieces of the figures, and then we're thinking about this in terms of, well, that announcement could lead to various intermediate outcomes, so information seeking, interpersonal communication, potentially changes in beliefs or attitudes or knowledge or things like that. Ultimately, those may lead to some of the behavioral outcomes, screening behaviors, prevention behaviors, et cetera. And then ultimately, we're trying to reduce cancer and get early detection to happen. But you can see the two boxes with the arrows pointing up are a whole set of factors that may mediate and or moderate the effect of the public figure announcement on various outcomes. And so this is where you get to a whole set of news questions, right? So how much news is devoted to this? What kind of coverage? Various questions there may affect what happens. And then lots of audience factors that we need to think about. So if it's if it's an African American celebrity, are African American more likely to respond? Are there other theory-based variables that we need to take into account? Health literacy. There's a whole set of things that we can think about in terms of kind of mediators and moderators that may happen. And as we'll see, there a lot of the studies that we talked about already show some of these sort of population level effects, but at most they've looked a little bit at demographic factors, but they haven't looked very deeply into who are the people that respond to this when these kinds of things happen. It's more just, there seems to be an effect here. So this is sort of the beginning of a conceptual model for us thinking about how this stuff may unfold and what may be important things we need to think about. Okay, so let me talk a little about some of the limitations of the literature that's out there to date, and then a little bit on some of the things that we've done. So there are actually few contemporary studies conducted in the United States. It's really kind of blown me away when we've looked at this literature. It's like, with all these high-profile, Elizabeth Edwards, all these folks, there's not a single study of any of those people that we've been able to find, and we've looked very, very, very hard. It's kind of amazing. Patrick Swayze, we actually found one little short letter that someone wrote in a medical journal about news coverage in Patrick Swayze. That's it. Elizabeth Edwards, nothing. Michael Douglas, nothing. It's really incredible. For whatever reason, our colleagues across the pond in the UK have really studied Jade Goody and some of those folks. Most studies examine only these sort of major public figure cases. There haven't been any studies, or virtually no studies, that have examined more sort of minor figures. And so I think that's important, because if we only study people that we think are going to have an effect, we won't know about folks that we're not sure about. And I'll say a little bit more about that. Limited number of cancers studied to date. Breast cancer has been the biggest one. But I mean, lung cancer obviously kills a lot of people, and there have been Peter Jennings and other high-profile cases, and there's no studies of those folks. There's definitely a lack of theory-based research. Don't want to criticize my friends in medicine, but folks in medicine don't feel nearly as strongly about theory as we do, and most of these studies are more on the medicine end of things, and there's basically no theory. And now, of course, everything's going online, right? Since a lot of the studies are older, when they've looked at information seeking, they look at phone calls to the Cancer Information Service, things like that. Now we have this thing called the internet, so we need to be looking at online information seeking. And you have kind of some studies of news over here, and you have studies of effects on people over there, and almost no studies that look at both. I guess maybe a few studies that look at both. But the extent that we can try to connect those two things is very exciting in terms of what's happening with the way the news unfolds, with what kinds of effects we see on people. So there's a lot of work to do here for folks who are interested in this area. And like I said, many fewer studies than I had expected to find in this area. So we did. So Steve Jobs died, and I was sitting in my office talking with Jessica Willoughby, one of our doctoral students, and we said, let's do a study. So,
How did you feel about it?
what's that?
So that's interesting.
Yeah, is that bad?
No, because you're trying to turn very sad lemons into very helpful lemonade. But how did you feel when he died and you got to work on that? How long? Right away?
Pretty quickly. Pretty quickly.
Out of a methodologically sound, or for methodologically sound reason.
Yeah.
Survey research you have to do.
Yeah. No, we were. I was pretty sad about, and I was pretty surprised. I was shocked. I had no idea that I had.
You weren't waiting.
No, there was no time to wait. We had to
Well, that's
go.
newspaper reporter. When something
Yeah.
bad happens, you go to work. You're not excited, but you're energized. You go to work.
Yeah, absolutely. There you go. That's a good way to think about it. We were energized. We were very energized. No, we were sad. I think we all have iPhones and love Steve Jobs, and we were sad, but we were focusing on cancer, and we said, interesting. So, so we had to move quickly to start putting together a survey and all that good stuff, and we ended up surveying young adults, college students at UNC, and also employees. And I'm going to focus on the employee study here. So what about theory? I won't spend too much time on this. So as I mentioned, there's been a lack of theory-based research. We focused on this idea of involvement, which will be familiar to many folks here: parasocial interaction, identification. There's kind of a distinction between these. We focus more on identification, this idea that not only might people have this sort of pseudo-relationship with someone like Steve Jobs, but the idea of identification is you're starting to adopt some of the attitudes, beliefs of that person, and that parasocial interaction often may lead to identification. And this has actually been looked at in previous celebrity announcement literature, just not in the cancer realm.
Can I ask a question, please?
Yes.
Can you just elaborate on that? What exactly do you mean by two processes of involvement?
Sure. So it's actually Brown who argues that these are both processes of involvement, and so they're both literatures. There's literatures on parasocial interaction, on identification. They both kind of go way back. And there's certainly some overlap and maybe even some confusion between these different constructs. And so the way that he argues it is that parasocial interaction is where we have sort of a pseudo relationship with a celebrity or a public figure. And many folks here are probably familiar with that concept, right? Pretty heavily studied in media effects. And so you have this sort of sense of intimacy with the person, even though you've never met them. And then Brown argues that identification, which again, from what I can tell, is a fairly independent literature but has some overlap, is kind of a step beyond parasocial interaction where you start to adopt some of the attitudes, beliefs, and even behaviors of that person you have this parasocial interaction with.
You're asking whether is that involved?
So Brown characterizes these.
By process here.
Right.
And so now it almost seems as if both parasocial interaction and identification could be antecedents of involvement. Right? That's what you're suggesting, isn't it? So you're saying
Or
that
actually the other way of reading them, originally you're involved in some way, and in which direction? Because parasocial interaction is a relationship.
Right.
Unfortunately, it's a relationship with somebody you're not really in a relationship
you're
with.
Right, right.
More involved, there's a greater chance of
Right.
more
And then-
parasocial interaction.
And identification.
So I guess my question is, we could have like a separate measure or concept of involvement altogether, right? And then that would also, for example, just from a methodological perspective, I would think that, the items on the PSI scale,
Mm-hmm.
the identification scale, and then we had some measures of involvement or elaboration.
Uh-huh.
I would suspect that if you put them all together,
Yeah.
you would see that there would definitely be some linearity there.
There'd be some heterogeneity that there would be. So you think these are relatively distinct?
I think so. I guess I
Processes.
just had a little bit of difficulty, trying to process this in terms of
Yeah.
the processes of involvement.
Yeah,
Yeah.
it's a heading you used, I think, without necessarily needing processes, so we jump on that.
Gotcha. Yeah, actually, I hadn't really thought about this involvement, but then I recently sort of adopted essentially Brown's take on this, where he does describe these as these are two in process being involved with with this figure.
It's also because you guys mentioned that you're looking at Petty and Casio for the ELM and stuff like that, right? So
Mm-hmm.
this
Yeah.
is so strongly tied to those frameworks.
Right.
And then this is
Involvement is.
Right. Involvement.
Not those other guys.
Not those
Right.
guys,
Yeah.
So you're mixing your folders.
So it
Gotcha.
could be something-
Well, I'll blame Brown 2010 for that one, but I do have to say that the identification literature and parasocial interaction conceptually doesn't seem like everyone agrees out there on, So this is sort of we adopted what Brown is saying because he's done several studies of this exact phenomenon. For whatever reason, not in cancer, but in other areas.
More from a media effects perspective,
Yeah.
Jonathan Cohen has done some really good work on
Uh-huh.
identification.
Yeah.
I think you might
Yeah.
want to look at some of his perspectives.
Okay. Yeah. Thank you. So long story short, we focused on identification, measured identification. We thought it would be interesting to look at. We also looked at cancer worry, which is, I think, more or less a theory-based variable that is heavily studied in the cancer realm. So in this survey study, we looked at what was the reaction to the death of Steve Jobs in terms of general information seeking and interpersonal communication. We also looked at specific to pancreatic cancer. And we also looked at this question of, so we're looking at information seeking here, also in personal communication. We looked at who was most likely to engage in those activities in terms of information seeking and interpersonal communication. So that was kind of our main focus. Don't want to spend very much time on this, but essentially we tried to do a stratified random sample. We used a web-based survey for this. Again, doing this kind of work is challenging because you have to move very quickly in order to, you're talking about development survey, getting IRB approval, and getting the whole thing up and running. You don't want to wait till 6 months after it happens, or people are not going to remember kind of where they were, how they found out, the kinds of things we were asking about. I think we were relatively successful. We got a 36% response rate, which actually is fairly good for a survey, and especially for a web-based survey. Turns out that web-based surveys actually have lower response rates than paper and pencil surveys, which surprised me. So we got almost 1,400 participants, so that was pretty exciting. 64% female. Women always take surveys more than men. Men are just a pain. Always, for whatever reason. The majority were staff, remainder were faculty. Mean age was 44 years old, and most reported being Caucasian and non-Hispanic. As I mentioned, we also did a study with students. We had a much worse response rate among students. Turns out doing an email-only survey is not a good idea with students. Apparently, they're all on their cell phones and Facebook, is what we're thinking. But with faculty staff, it was a pretty good way to reach people. So how did people hear about Steve Jobs' death? The largest number of people found out via the internet, and the second was television. So those were the two big ones. And it's actually specific to internet on a desktop or laptop computer. So much smaller numbers of folks found out through someone telling them, interpersonal, on a mobile device. Radio, several people found out from NPR and radio. Actually, a small number through social media. In the student study, we were very fascinated by the number one way students found out. Anyone want to take a guess? The social media, yeah. Something like 43% of the students found out via social media. So yes, the world has definitely changed, that's for sure. For among the adults, social media was much smaller. So what proportion of participants knew the cause of Steve Jobs' death? Just about everyone. We gave people a list of 5 different diseases and said, how did he die? And virtually everyone got it. Among the students, people were predicting that they wouldn't know. What proportion of students do you think knew what he died from?
85?
I believe it was 93%, right? So virtually all of them knew, which was kind of remarkable.
Did you ask the type of cancer or just cancer?
No, we did not. We had like heart disease, pancreatic cancer, and we had 5 different diseases, but there was only one cancer listed as pancreatic cancer, so we didn't try to distinguish. I suppose we could have had 5 different cancers and said which type of cancer, but they knew it was cancer. I guess that's the important thing that we did there. So I'm not going to go into great details here or talk through all the data, but again, we asked both. We wanted to know just about general information seeking. We kind of wanted to try to understand the context and general interpersonal communication. It's safe to say, and you can see some of the data here, this event really got people's attention. 3/4 of our sample talked to someone about his death, about his life or death, something about Steve Jobs. And that's pretty remarkable. And half actually sought information of any kind, reading the story online, that kind of thing. And you can see some pretty good proportions here of folks specifically talked about how he died or his disease, and in a smaller number, but still a reasonable number, sought information about how he died or his disease. So that was kind of for some context. Obviously, what we were most interested in was pancreatic cancer specifically. 17%, so nearly 1 in 5 people, talked with someone about pancreatic cancer in response to his death. And we tried to really understand this contextually, so we asked lots of questions about who did you talk with, how long did you talk for, when did you talk, what did you talk about, and so you can see some of the things that we found here in terms of understanding. It tended to be significant other or friends, tended to be for a relatively short period of time. Interestingly, we asked people if they talked on the day that they learned of his death or first few days after, and we had all these longer periods. Most people talked within the first few days, but not necessarily the first day that they learned of his death. And folks talked about treatments, characteristics of the disease. A small number talked about how to prevent pancreatic cancer. A smaller number here, 7%, sought information specifically about pancreatic cancer. Though again, 7% doesn't seem like a large number, but when you think about the millions of people that are out there, 7% turns out to be lots of people. And just about everyone searched for information online, right? So clearly, that's where people go now. And folks tended to search for 30 minutes or less, or 30 minutes to an hour. And again, most people didn't actually search on the first day that they learned of his death, but over the coming days. And people were looking for characteristics of the disease, treatments, and also how to prevent it. And by the way, before I did this talk, I looked online. I reminded myself, can you prevent pancreatic cancer? And so that, you know, for us, from a selfish perspective, this wasn't the best cancer for Steve Jobs to die of, because if it was one that was more preventable, there might be more opportunities to promote. But it turns out that, well, tobacco, eating a poor diet, and being sedentary, you know, are related to lots of cancers, and this being one of them as well. So if you want to try to prevent it, don't smoke, eat healthy, and exercise. And that will help. I can't promise anything, but that will help. Okay, so we also did, so again, we were really interested in this question of who. So who were these people? Who were the 17%? Who were the 7%? Who were the people that responded? And so we did logistic regression analyses, because we were looking at essentially, you know, did you seek information about pancreatic cancer? Yes, no. And we also did that in terms of interpersonal. So this is the one, this is the interpersonal communication. Who talked with someone else specifically about pancreatic cancer. And so folks who did, you can see, tended to be multiracial as opposed to other races or ethnicities. They tended to be people who engaged more often in general cancer information seeking. And the two sort of theory-based variables that we predicted actually panned out. So people who had higher cancer worry, and that was measured specifically in response to Steve Jobs' death. So people who worried about, you know, cancer in response to hearing about his death were more likely to talk about it, and same with, and identification also was associated with talking. And again, that's identification with Steve Jobs. We found similar results for those who sought information about pancreatic cancer. Strangely, we had this huge effect for folks who were Asian, who were much more likely to seek out pancreatic cancer information. I don't have a great explanation for that. Maybe you do. People with slightly lower education level were more likely to seek information, which is not always what you find in this literature, although our entire sample had higher education than the general population. Again, general cancer information seeking. And again, those two variables again predicted cancer worry and identification.
Seth, could you control, or could you look by department? These were employees. Yeah. So, risk of
By department?
Are there more Asians in med science?
That's a good, perhaps. Yeah.
So if you could look at
Yeah.
race-
Possible, though most of the sample were staff, so,
Well, but still.
which I don't know if that varies by department.
Not by anything.
Yeah. Well, that's interesting. If it was sort of a byproduct of some other, yeah, that's possible. Yeah. I don't think, yeah, we don't have what department folks were in, I don't believe.
How did you measure identification with Steve Jobs?
What's that?
How did you measure identification with Steve Jobs?
We used, it was like a 10-item scale that had, you know, solid reliability. And yeah, I believe it's something like 10 items that get at, you know, if they identified with him, if they felt a connection to him, if they, those kinds of things. Yes?
Did you conduct this survey before his biography came out, or after?
Almost certainly before. So we conducted, and just for time's sake, I didn't go into a lot of those details. We launched the survey, I believe it was 3 weeks to the day after he died, which was about as fast. And I was happy and amazed that we could, do it that fast. But that's definitely a limitation. It would be best to do it like, maybe a week after, But I believe that was well before his biography came out and all of that.
Newspapers write advance obits.
Yeah.
And then they fill in the details when the person dies, and so maybe, I guess you can't do advanced IRB.
Yeah, probably not. I asked Francesca. I believe I asked Francesca if there's any mechanism for a rapid, and you said no.
Yeah, well, this was after you died that you asked. Now, for the next person
Yeah.
that might die,
Yeah.
if you say in the future,
You could have some kind of.
Do a modification.
thanks to that potential IRB creep where they wanted us to submit templates for, possible breaking news when they were thinking that they wanted us to do IRB for our news. They were saying that they would be very happy with seeing submissions for like ongoing research that would have general templates and, a modification basically needed to be submitted for filling in the blanks with these specific subjects.
Yeah.
So yeah.
Yeah, no, it's definitely something I want to think about because absolutely, the faster you can move, the better. And the IRB actually around here is fantastic, and they were much faster than I had expected.
You would have some advance notice for big celebrities because,
Yeah.
it's not that there's an announcement made and then you don't hear anything until boom, you guys. Usually there's some kind of,
Yeah.
wow, this could be,
Yeah.
so if you had a name for your research team, it could be the Vultures.
Thank you, Rhonda. I appreciate that. Yeah, I appreciate that. I like your turning lemons into lemonade metaphor better. Yeah.
Hey, Vultures are using material that,
Yeah. Although you're not the only one. I think Noel Brewer, my friend Noel Brewer in public health, joked about us being ambulance chasers. So yeah. Anyway, so last point on this study, and we'll see what we can cover here in the remaining time. But we did find some evidence of mediation. So our conceptual model here was people who identified with Steve Jobs would be more likely to have worry about cancer in response to his death, and that those who had more worry would be more likely to engage in the two DVs, which was interpersonal communication about pancreatic cancer and information seeking. Again, since there's no screening test or anything like that related to pancreatic cancer, we couldn't look at sort of the harder medical outcomes, and so we focused on those DVs. And we found essentially support for partial mediation. We found support that mediation was happening, but that identification was still associated with the DVs, even after you take into account cancer worry. So cancer worry appears to play a part in the picture here, but it doesn't explain everything that's going on. That's essentially what we found. Okay, so let me skip over the details of this. I want to say a little bit about our Google study, and then, since we're running out of time, talk about conclusions here. So, but let me show you a little snapshot of the Google study. So this is from this tool called Google Insights, where you can look at what people are searching for. And it's a free tool. Anyone can Google Insights and hop on, and it's a really fun tool to play with and one you can use for research. But look at what people are searching for. It goes back to 2004. And so what we did was we tried to get at many of the limitations I talked about in previous studies. And we compiled a list of every celebrity and public figure out there who've been diagnosed or died of pancreatic cancer since 2006. And we plotted them on this chart, which comes out of Google Insights, the top one. And every square is a diagnosis, and every circle is a death. And you can see a lot of the early ones here, which are like 2006, 2007, there's nothing going on. Those are search queries. So the top graph there in red are search queries for pancreatic cancer. So search queries for pancreatic cancer are essentially flat for the first couple of years there, right? Nothing's going on. Then Patrick Swayze gets diagnosed, and bam, the biggest effect that we saw in this study was his diagnosis just led to huge numbers of search queries. Interesting, we also saw an effect for Griffin Bell, who apparently was an attorney general for many years ago. So that one was interesting and surprising a little bit. Patrick Swayze's death, also another big jump in pancreatic cancer search queries. Not as big as the searches when he was diagnosed. And then you can see Steve Jobs at the end there. And so all these other figures that we examined, we had actors, and we had list here. We had CEOs and college presidents and attorneys and artists and authors and Olympic medalists, and essentially many of them more sort of minor figures had no impact on information seeking about pancreatic cancer. And so this allows us to say, all right, well, let's look at this whole range of folks and see what's happening. The bottom bar here in blue is news volume, and we use Google News to look at news volume about pancreatic cancer. And you can see, again, you overlay your diagnoses and deaths with news, and you really don't see much going on. We were surprised that for Patrick Swayze, we didn't see a bigger bump there. But for Steve Jobs, there was just an avalanche, essentially, of news coverage that included talk about pancreatic cancer. So it's kind of an interesting and another way to look at things. As we know, cancer information seeking is so much online now, and I've not actually seen a lot of analyses like this looking at cancer information seeking, but clearly we need to do more of this kind of work because this is where people are searching now. Okay, so to wrap this up and talk about some conclusions, as I mentioned, Patrick Swayze diagnosis, death, and Steve Jobs' death were really the big ones. And we also did find some association between news coverage and queries, which is not entirely surprising. All right, let me sort of wrap up here as we're running out of time. I have a little time for questions, comments, things like that. One conclusion here is clearly that we need more research because there's so many of these cases that have happened, and we really have no idea what effects have been, both in terms of news and also in terms of people. But here are some initial thoughts about, so what? What's the purpose of doing this kind of research? Why does it matter? Well, clearly, events from these major figures capture attention and interest of the public. The studies show that there's huge increases in news volume, exposing large amounts of the population, and that people seem to be, very drawn to these stories. Lots of people read People magazine, and they cover this stuff in detail. In fact, one analysis that compared actually tabloid magazines to more traditional newspapers actually found in some cases tabloids to do a better job with some aspects of the coverage. So these may present sort of teachable moments, special opportunities that we can think about. So can organizations trying to promote various cancer-related behaviors take advantage of these to increase? In the digital age, this could even include purchasing links on Google. So when people are searching for that particular celebrity or cancer in the time after one of these events occurs, there's sponsored links. We all know that the health information online is variable, and so we can try to steer people to better things and try to promote certain screenings or other kinds of things that we want to take advantage of. That's one implication. The other is that these events, the effects in just about all the studies are fairly strong and fairly immediate. So it's a pretty quick and strong kind of effect. So just like we have to move very quickly for the research, folks who are trying to maybe leverage these, take advantage of these, also should move quickly because people's interest is really peaks at that early time. However, things take time, right? And when we see these effects on cancer screenings and things like that, you can't always get a screening the next day. So there may be opportunities, I think, for a reasonable period of time that folks can try to build on these for prevention in various ways. again, people seem to connect to these kinds of stories in a way that they don't or may not for a story about someone they don't know. So I think there's a lot of ways that, when these are just initial thoughts, I think there's a lot of ways we can think about using these kind of events and stories for prevention and other kinds of things. In terms of news coverage, I didn't talk about a lot of some of those studies today, but some of the content analyses show a little bit, are kind of mixed in terms of what the coverage tends to look like. So I know that University of Southern California has that group, that health communication group that works with Hollywood folks, right? And they try to get pro-social messages into popular shows. I don't know enough about the news industry to know if folks are doing that here, but I think we probably should be, right? So if folks are doing all these stories on Steve Jobs on pancreatic cancer, can we have affect those at all? Can we get them to cover more things about prevention, about screening, particularly in cases where those things exist? Because again, it's very variable how much that kind of stuff is in these articles. And some content analyses show that prevention, risk factors, all that stuff is often not covered. And it's kind of a missed opportunity, I think. And a last thought here, we do have to consider the possibility of negative effects. So recall that the Nancy Reagan, that event apparently had the effect of many women choosing a more sort of radical surgery that they probably didn't need. And in the case of Kylie Minogue, you had these huge numbers of very young women going and getting screened. And actually one study of Kylie Minogue essentially came out and said that that did not result in any increase in detecting cancer. So it may not have been a sort of most positive effect, but it's a careful balance, right? That is a tricky part with screening. I'm more and more depressed the more I learn about cancer screening, because I thought it was so straightforward, and now it's like, wow, these screening tests are much more imperfect than we'd like them to be. And we always had this early detection message, and now it's like, well, maybe. No, don't get screened until you're 40. No, let's move it up to 50. And so that's tricky.